Most of us by now know the symptoms of COVID-19, and many are also dealing with the after effects of an infection like so-called long COVID.
But some scientists are now linking COVID infections to another chronic condition, as our Trett found out firsthand.
Just 3 months ago, I was laying in a hospital bed having newly been diagnosed as a type 1 diabetic. Since I had no previous family history of the disease, but I did contract COVID-19 earlier in the year, I was informed of a study potentially linking the two, and now I'm bringing that information to you. With the COVID-19 pandemic all but in the rearview mirror, a new potential side effect is being studied for those who contracted the virus. Results from studies conducted in the UK, United States, and Germany suggest that people who had COVID are 30% more likely to develop diabetes than those who didn't. Many of the cases included people in otherwise good health with no previous family history.
We have seen an increased incidence of diabetes, both 1 and type 2, following a COVID infection. This isn't a total shock because one of the theories why we think patients develop type 1 diabetes is, maybe from a viral process that starts an autoimmune process and attacks the pancreas. So this isn't a terribly far-fetched idea. We're just now having the data that's kind of showing that.
Diabetes occurs when your body doesn't make enough insulin in order to help properly break down the food you eat, either because your body can't make enough of it or your cells stop responding to it. Over time, if left untreated, it can cause even more serious health problems.
Diabetes is a leading cause of chronic kidney disease and blindness. People don't always understand how serious it is. It can cause heart disease. It can cause liver disease. So it affects many different organs in the body. So very, very important disease to diagnose and treat.
While studies on the connection to COVID-19 and diabetes have only been going on for the better part of a year, doctors and researchers have been able to confidently rule out the COVID vaccines as a potential culprit.
Vaccines have been out, we're looking at almost 2 years. There really is no evidence that the vaccines lead to any increased chance of autoimmune disease.
Researchers noted that those who experienced mild cases of COVID-19 are less likely to develop diabetes than those who had more severe cases. It's still recommended that people who had the infection still stay alert for the warning signs.
The 2 most common symptoms would be increased thirst or going to the bathroom more, and that would be urination. Sometimes unintended weight loss. If you've noticed you've lost 20 pounds and have changed nothing with your diet or exercise, that could be a sign that you could be diabetic.
When patients have a really high blood sugar, they have the urge to drink, and then they urinate quite a bit. At that point, there's already been a fair amount of damage done.
Studies on this issue are still closely being monitored all around the globe, and even though no definitive answers have been given, we'll hopefully be getting some in the near future. Now, on a topic like this, it's always best to stay informed and trust medical care professionals. If you'd like to know more on the studies, you can find that information with this story at SiouxlandNews.com.